In today's video, I'll be talking about the danger signs you should not ignore as a pregnant woman. Stay tuned, I'll be right back. If it's your first time here, this is Motherhood Journey with Abiola. If you like this video and you want more content like this, ranging from pregnancy to postpartum lifestyle and motherhood in general, drop a comment on this video and ensure you subscribe to this channel. Let's build a team of mothers and even fathers that make a difference. If you see any of these signs I'll be mentioning, please do not hesitate to run to the hospital. Firstly, vaginal bleeding. Now, during pregnancy, bleeding can mean various things. The first one on a good note is implantation bleeding. Now, after an egg is being fertilized by sperm and the fertilized egg gets into the uterus, there is something called implantation bleeding. Now, this implantation bleeding is nothing like your normal period. It is very light and mostly people call it spotting, and it doesn't last. But if you start seeing blood over and over again that looks like your menstrual period, that doesn't stop in one day and is extending to up to 3 or 5 days, you might want to go to your healthcare provider in order to be checked. Additionally, bleeding can mean miscarriage, especially in the early stage of pregnancy. Another thing is placenta issues, whether placenta previa or so many other things. Additionally, a pregnancy is said to be to term from 37 to 40 weeks. But if you start bleeding earlier than 37 weeks, it may also mean preterm labor. Now, a preterm labor is a labor that comes before 37 weeks of pregnancy, and you wouldn't know what your own bleeding may mean. So the best thing is to see your healthcare provider if you are experiencing any vaginal bleeding during pregnancy. Additionally, severe abdominal pain should not be overlooked in pregnancy. If you are beginning to have a severe abdominal pain that refuses to go away or gets intense over a period of time, then you should go to your healthcare provider in order to be checked. If you are having severe headache accompanied with blood vision, it's important for you to be checked because severe headache can be a sign of preeclampsia, which has been associated with high blood pressure during pregnancy. Furthermore, severe or persistent vomiting. Now, although vomiting can be early signs of pregnancy because some people, immediately they get pregnant, they start having episodes of vomiting. But severe vomiting that would not go away, that would not allow you to retain anything, maybe water, food, fruit, or anything, that kind of severe vomiting should not be overlooked because it could be a sign of hyperemesis gravidarum, which is so bad for a pregnant woman and can lead to dehydration or a loss of pregnancy. If you notice any sudden decrease or sudden increase in fetal movement, you need to go to your healthcare provider in order to be checked because it could mean so many things. It could mean that your baby is in distress or something is wrong on the inside. And the earlier this is detected, the better for both the mother and the baby. Signs of preterm labor should not be overlooked as a pregnant woman. I mentioned earlier that a pregnancy is said to be to term from 37 weeks into pregnancy. Now, any signs of labor that you notice earlier than 37 weeks is considered preterm labor. How do you know you are experiencing preterm labor? If you begin to have a regular, frequent, and rhythmic uterine contraction that won't go away with change in position, then you might be experiencing preterm labor. Although there is something called forced labor, also known as Braxton Hicks contraction. But this Braxton Hicks contraction is nothing like your normal labor. It changes with change in position, it doesn't increase in regular frequency, and it is not rhythmic. So if you notice any sign of preterm labor, any sign of water breaking, any sign of bloody show, and severe backache, it's very important for you to see your healthcare provider. Lastly, before I go today, as a pregnant woman, it's important to listen to your body. Know what is normal and what is abnormal, so that if you notice anything different from the normal, you go and see your healthcare provider before things get worse. And that is all I have for you today. See you in my next video. Bye.